The clip.
I can't play anything. My phone is frozen.
Okay, we're live.
If I
Hi, hello, everyone. Good evening, good afternoon. Welcome once again to another episode on Real Men's Talk, where it is sizzling hot, interactive, and transforming. On this episode, we shall be talking about men's health, and we'll be looking at a topic, prostate cancer. Prostate cancer. So, what you need to know about prostate cancer is our topic for today. And I have my co hosts in the studio who are going to give us the knowledge, the things we need to know on this subject matter. We have Dr. Femi Samuel.
Good evening, viewers. Good evening, everybody.
We have also in the studio Pastor Sheyi Ojeni. Pastor Sheyi. And we also have Mr. Oluwafemi Oluwalere.
Good evening, viewers. Happy weekend.
And also in the studio is Dr. Akitude Akinyuga. Dr. Akinyuga is a consultant family physician. You're welcome.
Thank you very much. Good evening, everybody. Good evening, everybody.
Yes, so
thank you very much for inviting me here.
Good evening, sir. It's good to have you all on the show. So,
it's nice having you around.
Good evening, sir.
Thank you very much, sir. Good evening,
so
sir.
Like I said, that Dr. Akinyuga is a consultant family physician. So he's going to give us a short a short discussion on what prostate cancer is. He's going to educate us on prostate cancer before we start attending to the questions. So let's go from there.
Okay, thank you very much. Good evening once again. My name is Akinsunde Akinyuga, and I consider it a privilege to be invited to the show tonight to discuss something very important about men, and that is prostate cancer. There are so many organs that are shared between the two genders, that is male and female. We all have brains, eyes, hearts, lungs, kidneys, and so on and so forth. But there are two cancers that are peculiar to men and men only. And that's prostate cancer and testicular cancer. And the reasons are obvious, because women don't have prostates and women don't have testes. These two organs can only be found in men. But the equivalent in females, or the equivalent of testicular cancer in females, will be ovarian cancer. So today we are talking about prostate cancer, which we can consider the third testicle or the internal testicle, as its way. We all know what cancer is. Cancer is something that cancer of any part of the body is something that is a serious matter, and anybody that have experienced it before, or who has a relative who have experienced one form of cancer before, know what it means. And the cancer basically starts when one particular cell in the body decides to go out of control, and begins to divide and multiply rapidly beyond the control of the body, and then it begins to cause trouble. So prostate cancer, of course, is the cancer of the prostate, and it's the second commonest cancer in males worldwide after lung cancer. It's the second commonest cancer in males worldwide, and it's been said that it's more aggressive, or it's commoner among blacks than among whites, which is why it is so relevant to us in this part of the world. It's something that is common among blacks. Before we talk about the prostate cancer, let's talk about the prostate itself. Like we said, the prostate itself is like the third testicle, or the internal testicle, as it were. Is a walnut size or walnut shaped organ just located under the bladder in the body, and the urethra, which is the tube that connects the bladder outside, that carries urine from within to without, that is from inside outside, passes through the prostate. And so when we begin to experience some of the symptoms, or when somebody begins to experience some of the symptoms of prostate cancer, obviously some of it will have to do with urine. The major function of the prostate actually is part of what produces the seminal fluid. The outside world, what they know as sperm actually is not sperm. The real sperm is not something that is visible. You can only see sperm at a cellular level under the microscope, as it were. But what comes out of a man or during ejaculation is actually semen. We refer to it as semen. So that semen is a combination of fluid and sperm. So while the testis produces the sperm, the prostate gland is what produces the semen, that is the supporting fluid for the sperm. So that's about a little thing about it. And then it weighs usually about between 20 and 40 grams. It's something very small, like a walnut, you know. That's all about, that's just what I want to say about the prostate. So prostate cancer, like we said, is a cancer that affects the prostate. What are the symptoms? Or should I start with the symptoms or talk about the risk factors and the causes of prostate cancer? Actually, all over the world, when it comes to cancer generally, the exact causes of most cancers are not known, and prostate cancer is also
Dr. Krieger, can you
impossible.
hang on a little?
Okay, thank you.
Mr. Walere, please, can you mute your mic, please? Okay, thank you, sir. You can go on.
Okay, thank you. Like I said, generally all over the world, when it comes to cancer, the exact causes of cancer, most cancers in the body, the exact causes or the exact cause is not known. They are not known. And prostate cancer is not excluded. So the exact cause is not known. However, there are risk factors. When we talk about risk factors, we talk about factors that can predispose an individual, that can increase the likelihood of an individual coming down with a condition. When the environment is ripe, or when there's something in the environment that the person is exposed to, that person may come down with that condition. So risk factor for prostate cancer, the first common risk factor for prostate cancer is age. It is age. The older one becomes, the risk of prostate cancer increases. So the older one becomes, the more likely, usually most common after the age of 50. That does not mean that it cannot be seen in younger age group, but it's not very common below the age of 50. So the older one becomes, the higher the risk, or the greater the risk of coming down with prostate cancer. Excuse me. So the second risk factor of prostate cancer is race. When we talk about the race, we are talking about, of course, we all know what race means, where we come from, our origin. So when it comes to race, black people have a greater risk of having prostate cancer than people from other races. And even in blacks, apart from the fact that the risk is higher in blacks, the risk of having the aggressive type is also higher among. And then the risk of race is another risk factor. Don't forget, we say these are risk factors, they are not causes. They are just things that they've examined of people that have prostate cancer down through the ages, and these are the things they've been able to come out. So things that are common with people that come down with prostate cancer: age. Higher age group, the older one becomes, the more the risk. Then race. Then the other risk factor is also family history. Please, I hope we are still together.
Yes,
Please, are we still together? Can you all hear me?
we are. We are.
Hearing you, we're
Okay,
hearing
thank you
you.
very much. Okay, thank you. Okay, thank you. So the other risk factor is family history. Family history. So if an individual has somebody in his family, who has prostate cancer, especially maybe the father or the grandfather, then one can be at a higher risk of having prostate cancer. Then if one has a family history of a female that has breast cancer, maybe one's mother, one's sister, one's aunt, direct relationship like that, direct relatives like that have a breast cancer, then it puts the man himself at a higher has a higher risk of having prostate cancer. Then another risk factor too that has been associated with prostate cancer is obesity. Obesity. We all know what obesity is. When one's body mass index is greater than 30 and above. When we talk, I don't know whether this has been discussed in the past on this show, the issue of how to calculate one's body mass index, which is your weight in height. I mean, your weight in kilogram divided by the square of your height in meters. So kg over meter square, that's your weight divided by the square of your height. Weight measured in kilogram, height measured in meters. So that ratio or the outcome of that division is what gives rise to the body mass, is an index, body mass index. And usually the normal body mass index is usually between 18.5 and 24.9. Anybody that has that body mass index between 18 and 24.9, the person has a normal weight. Then from 25 to 29.9, we say the person is overweight. Then anything 30 and above, we say the person is obese. So obesity is a risk factor for prostate cancer. However, when it comes to obesity, some other studies also they also came out with outcome that obesity is not a risk factor. So it is not uh there is something mixed about obesity, but at least some study recognizes it that obesity is a risk factor. However, in obese people that have prostate cancer and are obese, they found out that the prostate cancer in them is more like, is more likely to be more aggressive among the obese people. And then for those who are obese, who have been treated for prostate cancer, the risk of recurrence is higher among obese people than among those who are not obese. Then when it comes to the symptoms, in other words, what are the things that, how can somebody know that he has prostate cancer? The first thing is that in most cases, prostate cancer doesn't give symptoms initially. It may not give any symptoms. Medically, we will say the person will be asymptomatic. In other words, sometimes or in many cases, prostate cancer is only discovered during screening. Maybe the person goes for screening. That's when they discover it. In other words, the person may not have any feeling, just like hypertension. The person may not have any symptoms and then just goes for screening, maybe a routine hospital screening. However, symptoms of prostate cancer will depend on the stage, whether it is early or late stage. One of the things people can begin to see when they have prostate cancer is that they can begin to see that they are having problem with their urine in terms of maybe they are not able to urinate normally like before. In that case, the cancer may have made the prostate cancer, the prostate glands to be a little bit enlarged. And don't forget, I said the other time that the urethra, the pipe that brings urine from the bladder, that is the storehouse of the urine and brings it out, passes through the prostate cancer. So sometimes when the gland is enlarged, it can squeeze, as it were, it can squeeze the pipe, making the flow of urine a little bit difficult. So that can be a sign, or sorry, a symptom of prostate cancer. Another symptom may be a decrease in the force of the stream of urine. Normally there's a way the urine should come out. There's a stream, there's a force which it should come out. But the person can begin to notice, the affected individual can begin to notice a reduction in the force of that stream of urine. Another thing that one can begin to notice is blood in the urine. Now, blood in the urine in a middle-aged man or somebody 50 and above should send a signal that that person may have prostate cancer. Except, another thing that can give blood in the urine, if, for example, somebody has urinary tract infection or schistosomiasis, but that one will be common among the younger age group. Maybe you see a 17-year-old boy who probably maybe lives in the village, or who has contact with stream, wading in streams, now coming down some months or some years later with urine in blood, blood in the urine. One can think of schistosomiasis. But if you see blood in the urine of a 50-year-old man and above, then that should send a signal that that can be due to prostate cancer. Another way it can present can be blood in the semen. The person can begin to notice presence of blood after ejaculation, can see blood, which is not normal. Normally, after ejaculation, one is not supposed to see blood. So when one is ejaculating and one is seeing blood, mixed with the semen or mixed with sperm in contact with the prostate, we
Hello.
think it's like that. Hello.
Okay.
Yeah, can you
Are
hear
you
me?
there?
I can hear you.
Loud and clear.
Hello.
Yeah.
We can hear you loud and clear. You went off for a while.
Okay, I was trying to clear my throat. Sorry.
Okay.
Okay.
So yes, thank you. Another symptom of prostate cancer is that, like I said, one can begin to lose weight. Especially if you see an old man losing weight and the person is not coughing, the person is not actively bleeding, is not stooling, things that can, and then the person is not fasting, as it were, not starvation, the person is not starving, an elderly man, and then begins to come, you just begin to notice the elderly man losing weight. You've done chest x-ray, you didn't see anything, the mind can begin to go towards prostate cancer. And another striking thing about prostate cancer is that it can cause bone pain. If I've seen a patient before, an elderly man, I think he should be in his late 60s or early 70s. The man was just complaining of bone pain, and he was losing weight. And then he had history of transfusion. He had had about 2 or 3 pints of prostate until when he came to our hospital, and we were just doing ward round that day, and it just occurred to us, let's check this man's prostate. And lo and behold, the prostate, examining the prostate, we saw it. He had features of prostate cancer. The prostate was very hard and enlarged. That was when he dawned on us that, okay, this was what was causing this man's repeated transfusion and bone pain. The man was in serious pains. So when you have an elderly man complaining of bone pains, serious bone pains, and is losing weight, that can be a sign of prostate cancer. And then, of course, like I mentioned, when you see somebody just becoming pale, an elderly person an elderly male now becoming pale without any obvious cause, no active bleeding, and is becoming pale, one of the things that can be a cause, and then the person doesn't have a kidney failure, one of the things that can be pointing at is that the person may have prostate cancer. And then another thing that prostate cancer does, well, it's not too good for males because it's one aspect of life that is very germane to male health. That is erectile dysfunction. So prostate cancer can cause erectile dysfunction. And of course, erectile dysfunction can also come as a complication of his treatment. But then prostate cancer on its own can cause erectile dysfunction. So how do we make a diagnosis of prostate cancer? Of course, so like I said, most of the time, prostate cancer doesn't give symptoms. When one comes to the hospital, a male patient, or sorry, and a male individual, maybe above 50, having problem with urination, one of the things we do, of course, we examine the person, and part of the examination is that we have to examine the prostate. And looking at where the prostate, while examining it clinically, is that we have to insert our hand through the anus, the calip. We have to insert our hand through the rectum or through the anus and then feel for the prostate. And one of the things that can give it off is while examining the prostate, it can be very hard. Normally, the prostate should not be hard. It can be firm or rubbery. That's the normal consistency when you feel it. But in that case, you can feel something very hard. Sometimes it can be craggy, have a rough surface. The surface normally should be smooth. But then when you begin to feel something rough like that, it can be a pointer that this person has prostate cancer. And then after examining the patient, we have to do investigation. We can send for a scan, an ultrasound scan to show us the prostate. And then one blood test we can do, or one of these common blood tests to do in order to be able to assist in making the diagnosis as it were. We call it serum prostate serum antigen (PSA). Prostate serum antigen, that's the PSA. And the normal level usually should be between 0 and 4. But if you do your PSA and then you're having a level above 4, it could be a pointer. So I'm choosing my words carefully now because it is not every value that is above 4 that means prostate cancer. But then somebody that does that test and then comes with a value of above 4 can be a pointer to prostate cancer. Of course, you have to marry what you find with what you find clinically. You have to marry the investigations with the clinical findings before you can now say, okay, this person has prostate cancer. But the best way to diagnose this actually is by doing a test, taking a sample of the prostate itself. We call it biopsy. It's like taking a small bite from the prostate and then sending it to the lab. So that is when you can actually conclusively make the diagnosis of prostate cancer. Well, treatment of prostate cancer, it depends on the stage. It depends on the stage at
Okay,
which the
Dr.
individual
Delia,
comes to the
before we go to
hospital.
the
It depends on
treatment,
this.
before you go to the
Okay.
treatment, I would like to ask if prostate cancer is life-threatening. Is it life-threatening?
Is it life threatening? Oh, okay. Thank you for that question.
Yes.
Any cancer, any cancer can be life threatening. I'm trying to choose my words because, like I said, it depends on the stage and the type of the cancer. It depends on the stage, but normally cancer is not a normal thing. So anywhere there is cancer in the body, of course, the person feel threatened, and any cancer is life threatening. However, a lot of autopsies were done sometimes ago, in study, and they found that many elderly people who died from other causes, they found out that they also had prostate cancer, but it was not the prostate cancer that led to their death. It was just during autopsy that they found out that they also had prostate cancer, but the prostate cancer had nothing to do with their death. That tells us that it is not everybody that has prostate cancer that will die from prostate cancer. So they say that some can live with prostate cancer and then some will have prostate cancer and die from prostate cancer. So cancer generally is life threatening, but it is not, the truth is that it is not everybody that has prostate cancer that will die from prostate cancer. Some people can actually live with it without, depending on the type of the prostate cancer.
Okay, you are going to tell us about the stages. Then we want to know how long does it take prostate cancer to spread?
Well, how long it takes to spread will depend on the type, because there are different histological. Well, when we mean histological, that means the nature of the cancer itself. There are different types of cancerous cells, different type. But the commonest one is well they call it adenocarcinoma, but that's not for. But usually on the average, it may take up to 15 years sometimes before it even spread. That's why we're saying that sometimes some people will just, the cancer will just remain within the prostate gland. It will not go beyond that gland. It will not affect the person. It will not even affect anything about the person except that it was discovered that the person has prostate cancer, and then the person will live with it, live till old age, die from some other cause or die from old age, and then it's only during autopsy that it will now become an incident. That is, they just found out that, oh, this man's prostate gland was cancerous. However, that cancer was just indolent, just lying fallow there, did not give the man any symptom. However, there are some other prostate cancer that can be very aggressive and will spread, and usually it has predilection for bones. That is why bone pain is one of the commonest sign of advanced prostate cancer. In fact, I had a colleague, well, he's also a medical doctor, a senior colleague. His father died from prostate cancer, and they did not know until that cancer had spread before they arrived at that diagnosis. The elderly man kept complaining of low back pain, low back pain. So the man will go to the hospital, they will just give him pain reliever, he will go back home. He kept complaining of this low back pain until one day a doctor just cared to, this elderly man that is complaining of low back pain, let's examine the prostate. And that was how they found out that the elderly man had prostate cancer. But this time around, the prostate cancer has spread to the vertebral bones, and that was what was giving the man low back pain. So if a middle-aged man or a 50-year-old man and above keeps complaining of low back pain, one of the things that should be examined or should be screened for is the prostate. To check the prostate gland whether it's not the cause of the back pain. So on the average, it may take about 15 years actually for the cancer to spread to other parts, especially to the bones, because prostate cancer has predilection for the bones.
So is there cure for prostate cancer? Is there cure for it?
Okay, thank you. Thank you for the question. Well, prostate cancer actually can be cured. It's curable. However, it depends on the stage. If it is detected, and then it depends on the stage, then it depends on how early it is detected. So if it is detected early and it's still at the early stage, it can be cured. However, if it has become advanced, then it can be managed but may not be curable. And then it can be managed and the person can still live 5, 10 years. The person can still continue to live. At least I have somebody in my own church at home now, an elderly man. I think he had the surgery for prostate cancer. He had the surgery some years, I think it'll be about 3 or 5 years ago now. The man is still alive and is doing well. So prostate cancer is curable provided it is detected early, and then it is still the cancer itself is still in the early stage, and then it also depends on the type, the particular subtype of the prostate cancer.
So for those people that have the risk factor, maybe they are closer to that age or they are around that age range, their race and all that, is that what do they have things they can do to prevent it?
Okay. Prevention of prostate cancer and even cancers generally. Well, like we said, there are some things that are called modifiable risk factors, and then there are some risk factors that are not modifiable in the sense that you cannot modify your age. You can modify your weight, but you cannot modify your age. You cannot modify your family history. You cannot modify your race, as it were. However, the risk of prostate cancer can be reduced slightly, by choosing to live a healthy lifestyle. That is just the summary of being able to reduce the risk. When we talk about prevention, prevention is also in stages, or should I say, prevention also has its own classification. We have primary prevention, secondary prevention, tertiary prevention. So primary prevention is, preventing somebody from having the risk factors in the first place, while secondary prevention is, early, detecting the condition early and then going for treatment, while tertiary prevention is just managing the complications. So for prostate cancer, for example, like we say, you can't do anything about your age. Everybody prays to get to live long and to be old. So, and that's a risk. That's the risk that comes with old age. But then for your one's weight, one can do something about the weight. And then when it comes to diet, because that's another thing we see in the hospital, when people talk about diets to preventing prostate cancer, the truth is that
So can you emphasize on, okay,
there's no specific diet
maybe,
that can control.
okay, you can go on the diet.
I can't hear you again.
You were
Okay.
talking about
So
the
when it comes to
diet
diet,
that, yeah.
yes, yes, that there's no specific diet as its way that can prevent prostate cancer as its way. However, the same diet that is necessary to maintain healthy lifestyle is still the same diet that we recommend for people generally to prevent any form of cancer or heart problems. And that is something that everybody now knows is a diet, fruits and vegetable, and then reduction in fats, fatty meals, fast foods. Generally, science is coming to discover that now, that vegetable, fruits, fibers, all these things, they are very good for our health generally, not just in preventing prostate cancer, but in maintaining a healthy lifestyle is something that's the only thing that can be done to prevent the risk. And then coming to secondary prevention. Secondary prevention, like I said, is early detection and treatment. Early detection means anytime you start feeling there's a change in your pattern of urination, or there's a change from normal generally, then it's better to quickly go to the hospital so that one can be examined and then screened, and then if there's anything can be detected early and then treated. So when it comes to diet, the most important thing is having a healthy diet. The subject of diet now is something that is gaining interest all over the world. If you go on the internet, there is a lot of diet that people have talked about. And having read through most of this, I have come personally to a personal conclusion that just moderation in everything you do, moderation in everything you do, and most importantly, let fruits and vegetable be much in your diet. Vegetable, fruits, fiber, fish, and then one should restrict and one's calorie intake, exercise, and maintain healthy diets. These things I've mentioned cut across almost common conditions that were announced, especially chronic medical conditions, hypertension, diabetes, cancers generally. It's a diet of vegetable, fruits, fibers, fish, maintaining a low salt, low fat diet, and maintaining healthy weight. Healthy weight is something that is good generally. So it's not just for prostate cancer, but for even our health generally.
Thank you so much, sir. Before I will say other people can ask their question, I want you to emphasize on healthy living as you have mentioned earlier. Is it just about the food we eat? Because you have emphasized on our diet and the rest of it. So talking about healthy living, we got prostate cancer. Is it just about our nutrition? Do we have some other area of life you think people need to know?
Okay. Well, thank you very much for that question. The issue of healthy living, like I said, is not just something that is, when it talks about healthy living, it has to do with the choices we make on a daily basis. The choices we make, what enters into our mouth, and then what comes out. What enters into our mouth in terms of food and drink, beverages, and every other thing, and then what comes out in terms of maintaining our weight, that's exercise generally. And then WHO actually, they came around with 12 areas. They did a study, and then they came about with 12 factors that one should look at when we are talking about healthy living. So diet is one of those things that they talked about. Exercise is one of those things that they talked about. Maintaining healthy diets, exercise, is being physically active is part of it. I know their own definition of physical activity is that anybody that spends more than 4 hours or more in front of the laptop or TV is living a sedentary lifestyle, and that is not good. So physical activity, one must be physically active, one must do exercise every day. They also talk about tobacco use. I'm talking about healthy living now generally. That WHO came around with those 12 areas. They also talk about the issue of tobacco, cigarette smoking. It's not encouraged. Then the issue of alcohol too, avoiding or minimizing the use of alcohol. We talk about what is going inside. So when we talk about diet, it is what is going inside. Tobacco is what is going inside. Alcohol is what is going inside. Then when we talk about physical activity, that's exercise. That is what is going outside. It's like input and output. They also talk about getting vaccinated. Vaccine is one of the things that is one of the major breakthroughs of science, especially from 1978 when they were able to eradicate smallpox. Since that time, vaccine became part of human living. You have to vaccinate under 5 children. And one of the areas of controversy of vaccination right now is COVID vaccine. Is something that is causing a lot of controversy. But vaccines generally is another. So vaccine is part of what comes into the body when it talks about healthy lifestyle. Another area of maintaining healthy lifestyle that WHO talked about is managing stress and mental health. We know that we are living in a stressful world. Everybody must devise a means of managing stress. Then they also talk about good hygiene. So stress will be part of, we have to manage what is coming in and manage what is coming out. Hygiene also is part of what WHO mentioned when it comes to healthy lifestyle. Then another interesting area, in fact, when I saw it myself, I was surprised, but it actually should not be a surprise because they found out that one of the commonest causes of death between the ages of 15 and 45 all over the world is road accidents, crashes on road. So WHO also included that in maintaining a healthy lifestyle. In other words, when you are driving, don't drink. When you are drinking, don't drive, and don't overspeed. That's why I said I was a little bit surprised, but actually we should also not be surprised, because accident is one of the common causes of death among the younger age group. They also talk about using seat belts, so using seat belts, using helmets, protective helmets when one is driving. And then another area which I talk about erectile dysfunction as part of what prostate cancer can cause. But one of the areas of maintaining a healthy lifestyle, according to WHO, too, is practicing safe sex. We all know what that is all about: A, B, C, D, E. And then regular health checks. This is where most men, or most Africans, or let me say Nigerians now, this is the area where we have challenges. Our health seeking behavior is not too good. When people have health challenges, the first point of call for most people is the chemist. A chemist is not a hospital. That's what I tell some of our patients. The chemist is not the hospital. When the car is faulty, you don't take your car to a carpenter. You take your car to the mechanic. When you have a problem with the furniture at home, you don't take it to the mechanic, you take it to the carpenter. So when you have a problem with your health, where should you take it to naturally? But we don't go to the right place in most cases. And then they also talk about breastfeeding for babies. So healthy lifestyle is all encompassing. It has to do with not just our physical health, it has to do with our mental health and even our social health.
Thank you so much, sir. So I'm going to start with Mr. Oluwalere. Do you have any question for Dr. Akinyuga regards this topic?
Thank you very much, sir. And we really enjoyed the lectures, even though most of them are so technical to us because we are not on the line. I know Dr. Femi will be so happy. He's the one who will understand it more than us. But be that as it may, there are some little things I put down: decrease in urine, blood in the urine, old man losing weight and not fasting can cause bone pain. Do we then say that if at any time one does not urinate well, we regard it as if it is prostate cancer, or we still need to go and confirm before we maybe
Hello, sir.
just
The line is
jump into the
breaking.
conclusion? Okay. I said one of those
Please, I
symptoms
didn't
you
get you,
gave
sir.
was,
The line was breaking. That if somebody is not urinating well.
yes, you said it could be prostate cancer. But I said, do we just conclude like that, or we still have to go and do a test rub before we conclude that it could be prostate cancer? Thank you. Did you get the question?
Okay, sir. Thank you for your question.
Thank you,
Hello?
sir.
Hello?
Sir?
Hello? Dr. Akin, maybe let me just address.
Hello, Dr. Sam.
Hello? Maybe let me address Dr. Oluwalere's question.
Hello, sir.
After 40 years,
Okay.
hello, can you hear me? After 40 years, most men will
Yes.
discover that they don't urinate as if the flow of the urine is not the way it was when they were young. A little child of 3 years old can urinate, and the urine can touch the ceiling because of the pressure. The flow is good. But after 40 years, you notice that the urine doesn't flow the way it is. There is a little bit of obstruction because the prostate is getting enlarged. It's being used, it's getting enlarged. So there may be a little bit of reduction in flow. They will start urinating, having what they call post urination dripping, in which after urination you have to shake the male organ to discharge all the urine. They may urinate and there will still be residual urine. Those things are not actually signs. They may not be an outright sign of prostate cancer. They are what shows that you are getting old. Another symptoms you may have is that you may be going to toilet frequently. Prostatism, in which you go to toilet frequently and all those are not really signs of prostate cancer. They are part of the aging process. Am I right, Dr. Akinyuga? Though I'm not an urologist, neither am I a family physician. I deal with women. Dr. Akinyuga.
Thank you, Dr. Sam. So anytime an individual notices a change in his usual pattern. Everybody has a pattern, but the moment you notice a change from your normal or usual pattern, then it's good to just have a check. It's good to just have a check. So, like Dr. Sam said, there are some things that come with aging that are natural, but there are some other things too that are not natural. So, the onus is on everybody. Once you notice that change, and you notice that this is not your usual pattern, then it's better to come to the hospital and just check. It might be a normal, it might just be as a result of aging, but at the same time, it could also be due to prostate and issues. So that would just be my answer to that question. Everybody knows what is normal. You know what is normal to you. I know what is normal to me. Once there's a deviation from the normal, then it's better to just have a check. And the earlier, the better.
Thank you, sir. Pastor Sheyi, do you have question or you want some clarification on the subject matter, sir?
Yes. Well done, doctor. Very good, extensive analytical discussion. But I have a reservation for your last comment. Are you listening, sir?
Okay, sure.
Hello? Can you hear me?
Yes,
Hello,
I can
doctor,
hear you,
can you
sir.
hear me?
Yes, I can.
Okay.
I can.
When you said anytime you notice a slight change, you go and visit a doctor. And I was looking at it. I remember there was a time, quite some years ago, that I do that regularly. And it got to a point that the doctors like, you just like coming, they were almost like, you just like coming to hospital. Because any little thing, I'll go, So those guys, and most of the time I meet young doctors. So they were like, man, you don't have any issue, and I was almost becoming like a pest. So what I was going to suggest, it's the extensive check, maybe 6 months or 1 year. I feel that comprehensive. I think that's the language of medical people.
Yes, I understand what you're saying, sir. Yes, sir.
Yes, the comprehensive will relatively give you a better picture of what your whole body system look like. Instead of, because don't forget, Dr. Sam just said, if you have age at so time, you should expect your urine to pattern to be like this. If an average person might not be conscious of all that. That's it. The body is already going closer to where it came from as you age. Some people does not like hearing those statements, yes. But that's the bitter truth. And things come up. I remember one of those days I was doing exercise and I just had care, by my left bone. I had to call my sister. My sister is a medical person, and she said, "What were you doing?" I said, "I was running up and down the staircase." And she said, "Oh boy, do you know how old are you?" I was like, what's the big deal? And he said, "No, you can't do that kind of exercise at this age again. That it's not the kind of exercise that you get involved. The exercise at this stage is just brisk walk, for like 45 minutes.
Walk, yes.
So that's really, but I would not have imagined that could happen just because I felt I was running down up my staircase and all that, So that's why I'm saying that as much as possible, you shouldn't be going to hospitals every week, or else they will almost time you to another thing. And God forbid, now that everybody is running away from other things, You go in your process of running to all hospitals, you carry another thing from the hospital, and it become more complicated for your health. So I think one of the things I would suggest to everybody is the comprehensive test. At least what I think WHO suggested, recommended, was at least once a year. Once a year, go and do comprehensive, and it's not very expensive. I know that you can be as low as less than 100,000. You know, for some hospitals. In fact, there could be some that could be as low as 40, 60,000. You know, that I'm not sure that is too much for your health. That's my own recommendation or advice. Then secondly, one of the things I feel that you did not mention is that at the late stage of prostate cancer, you have you won't be able to hold your bladder again. You know, people with last stage of prostate cancer, they go to they just some of them even urinate inside their you know, when they are at that stage. I met a man at the hospital, and I discovered that was the challenge, and I think they just told me that's the last stage or late stage of prostate cancer. Thank you very much, sir.
Yes, sir. Thank you, sir. Let me start from the last one, sir. Thank you. The urinary incontinence incontinence means inability to hold urine, like you rightly said, sir, can be a sign of prostate cancer. But it's not only prostate cancer that can cause incontinence in the old age, but it actually can be one of the signs of prostate cancer, and even the treatment also. Then, like you rightly said, sir, the issue of comprehensive health check. You know, I mentioned earlier, sir, while I was talking about what WHO said about maintaining healthy lifestyle. Part of maintaining healthy lifestyle is going for health checks. Then, what I meant by a change, that once you notice a change that's why I said once usual or normal pattern. You know, once you notice this persistent change, for example, now somebody that wakes up only once or twice to urinate in the night, now suddenly starts waking up 4 times, 5 times, 6 times without taking tea before sleeping, or it wasn't a cold night, or the person was not awake in the night, and it's been on and on like it's been persistent, then the person needs to get to the hospital, because the person knows that that is not his usual pattern, and it's been maybe 1 week, 2 weeks, 3 weeks, you know, things which is not normal for the person. Somebody who wakes up once or twice, now waking up 4 times, 5 times, 6 times, and the person is also not on some antihypertensive drugs that can make him or her urinate, or make him urinate, because we're talking about prostate tissue. Then those are the things I was talking about. That once the person notices that this thing is not my normal, or my, because for one to come to that level that this is not my normal thing, then that thing must have been on for some time, and then it's becoming a source of concern and a source of worry to that individual. Then it's better to check. And then also, now everybody has access to the internet, so sometimes one can just type in some questions. Causes, I'm just using frequent urination as an example now. That what are the things that can cause frequent urination in the night? Just type in Google, and then things will come out. But then sometimes also one must be able to synthesize some of this information on the internet to be able to arrive and make the right decision. So just like you said, sir, that sometimes you also need to call a medical personnel, maybe a friend, a colleague, and just put some questions to him or her. Okay, what should I do about this? And then the person will give the appropriate advice. Thank you, sir.
To get consultation, hope they are going to pay for those consultations when you call a colleague or friend.
Oh God! So now,
because you cannot call a lawyer and then ask questions from a lawyer.
It is called Prostrate local government.
Sorry, observation, sir. Hello? Hello?
Hello, sir.
Hello?
Yes, sir, we can hear you,
Hello,
sir.
We
can hear you, sir.
Is there any way, okay, is there any way we can respond to, is there any way you can respond to those chats? Because I can see about 8 chats. And I know those people must likely be asking some questions. Mama T, is there any way you can get in touch with those charts?
I cannot see them. Let me see.
I'm seeing 8 charts.
No, those
Can you
are
read them,
What
sir?
about Dr. Femi?
Those were
Sorry?
charts. The ones I can
Is
see
it on the
here.
live stream? Okay.
What
okay,
I'm trying to say
okay.
is there any
Those
way
ones
they
are no
can get
questions,
those
sir.
charts?
Yes, they're
Sorry?
not question for the house. It's not. Let's go on,
There's no
sir.
question.
Those charts, those charts, do you know whether some of them are not questions?
They are not
Okay, we have gone
questions.
through them, sir.
Okay.
Yes, I've read them.
Okay.
Yes, sir. And okay, I would like to ask if there is vaccine for prostate cancer. Is there vaccine?
Okay, well, as far as I know, as of today, science is advancing and knowledge is moving at a very fast rate. But as far as I know, there is no vaccine yet to prevent for the prevention of prostate cancer. For now, I don't know of any, or I'm not aware of any. Yeah.
Thank
Can
you,
I
sir.
answer that question, sir?
Go ahead, sir.
Yes, sir.
You discover in the village, most of our villages are old men. They don't experience all this type of things. Reason maybe, I don't know, maybe the type of food they eat, or maybe the type of all those leaves they eat, maybe cold. I don't know. But let me ask, why is it that those things, all these things are always common in the cities and they are not really prevalent in our local environment or villages? Thank you.
Okay. Thank you, sir. Well, I will answer it from two directions, sir, or from two angles. Yes, we might say that in those days, in those olden days, we may not have been seeing those things, but actually, it's not as if those things were not present. But science, our own science, I'm talking about us Africans now. In those days, we may not have known that those were the symptoms. We may not have been able to describe some of those things that some of those our older generations, our forefathers experienced. Some of them might actually have had some of these things, but because then it was a dark age, in quotes, dark age, we may not have been able to say that okay, this was prostate cancer. That's one angle. So those things were present then, even though the prevalence or the incidence may not have been high as we have now. Then secondly, sir, about not having them in the villages and having them in the cities. Science have found out, and like we all know, because all of us, we interact on the internet, that the adoption of Western lifestyle also came with some detrimental things, and those are the chronic illnesses that are prevalent now in our generation. When we talk about chronic is just talking about time, that is illnesses that someone can live with for a long time. For example, hypertension. One can live with hypertension for 20-30 years, diabetes for 20-30 years, and even HIV. In those days, when we were in medical school, HIV in quotes was like a death sentence. But now we have association of PLWHA, people living with HIV. They have HIV and they are living their normal lives. So with the advent of adoption of Western lifestyle, we also adopted some of their chronic illnesses, and that is why permit me to speak now biblically, because I've come to realize that science is just discovering what is in the Bible. If you remember that when God created man, our diet essentially was plant-based diet. Initially, when God created man, it was vegetables and fruits, and that is what science is going back to now, talking about fruits and vegetables. So it was after the flood of Noah that God introduced meat to our diet. But before then, it was basically, he said, I give you the tree bearing fruits for your diet. So science is now going back to fruits and vegetables, which is the original thing that God gave. So I'm not saying that we should not eat meat or fish, but of course, we've all seen studies and researches now showing that red meat, after the age of 40, one should begin to cut down on red meat. And then, all these beef and things, as so many of us like asun and suya, we need to start cutting down on those things. and then become more plant-based, fruits, bananas, plantains, watermelon, all these things. We should invest more in them. And we should also train our children. Many of us are guilty of introducing our children to some of these things right from childhood rather than giving them fruits. Let them get used to fruits, from when they are young, and then it becomes part of their habit. So that's my answer, sir, is that we adopted the Western lifestyle. And of course, with the adoption of the Western lifestyle also came with these chronic illnesses.
Thank you, sir. Dr. Samuel,
Yes, ma'am.
do you have anything to add to it before we wrap up today?
Thank you very much. Dr. Akinga actually said a lot. Well, I said a lot. I should be eating vegetables and fruit. But for young people like us, we can still manage it. So thank you very much, Dr. Akinga. We hope to see more of you, more of your lecture these days.
And thank you
I
everyone.
consider it a privilege.
Thank you everyone for being part of today's show. And thank you very much.
Unfortunately, we didn't see the face.
You see his face next week.
It's a gentleman. It's a gentleman. Pastor, I think you're a pastor and a doctor, Abi. Dr. Akinga.
I'm a doctor, Dr. Sam. I'm only pastoring my wife and children. I'm a doctor.
That's interesting.
All right. Thank you, everyone. Thank you, viewers, for being part of today's episode. On this note, we are going to wrap up on this topic, and we hope that you join us as we do this again for another conversation, for another interesting topic on Women's Talk, where it is sizzling hot, interactive, and transformative. Thank you, and good night. Have a wonderful weekend.
Good night.
Good night. Good night, everyone.
Good night, everyone.
Good night. Let's just stay at the background. Let's talk for the next 5 minutes before the end. Good night, and God bless you.
Thank you.